Hello, it's Midwife Ali. Today we're going to be talking about hyperemesis, something a lot of people suffer from. We're going to talk about how to kind of manage it and what to do if it gets really serious. I have my freezer bowl filled with frozen fruit. Just have a few different things. The reason I tend to buy the frozen stuff is because I go on and off frozen fruit. So sometimes I might go like a week without wanting any kind of fruit shake, and then if I'm buying fresh fruit, if I'm buying fresh fruit, obviously it goes off and then it all ends up in the bin. But this way, I can keep them in the freezer, kind of use it whenever I want. And a lot of these frozen stuff have like 2022 expiring date, 2022. So you can tend to keep them for quite a long time. Nausea and vomiting does affect up to 90% of pregnant women. I think sometimes when it starts happening, a lot of people can think, why am I not coping very well with this? But it is absolutely normal. It's caused by the rising level of estrogen, progesterone and HCG in pregnancy. When you're pregnant, you do get an increased sense of smell, and a lot of times that can increase vomiting. So I can't tell you how many times I've opened up a press, I've been like, what is that smell? And my husband is looking at me like, what smell? Men just physically do not understand. And so it usually starts from about 5 weeks. I am currently 19 weeks, and I'm happy to say the vomiting is a little bit behind me now. However, I'm going to talk about a few of the ways that I've found to cope with them, a few of the things that, as a midwife, we would advise that you do. Someone may have nausea, just normal pregnancy, 5 to 14 weeks nausea and vomiting, and somebody else could have moderate vomiting, which is something a lot more intense than the just average normal nausea and vomiting. And then there's the more severe case where we call hyperemesis. Morning sickness would be the normal pregnancy type, where you wake up in the morning and you just feel sick from the get-go. You might vomit, you might not, and then you just kind of go about your day. You can feel nauseous every now and then, but you still manage to hold down food. You still manage to hold down fluids. Now, when we're talking about moderate vomiting, this is a little bit more severe in the sense of those women tend to vomit throughout the whole day. A lot of times after meals, a lot of times they might find that it becomes more difficult to hold down meals, and women generally start to show signs of dehydration and weight loss. Hyperemesis tends to begin at around 10 weeks. It is a more pathological form of vomiting. It begins more around 10 weeks. You may start off with the usual morning sickness that a lot of women does start from around 5 weeks, and then as the pregnancy progresses, the symptoms become more severe and you can end up with hyperemesis. Women with hyperemesis very rapidly will show signs of dehydration. They'll start to show ketones in their urine. So if they go to the hospital, there will be a high level of ketones in their urine. You might find that you're not passing urine for up to 24 hours. Weight loss becomes severe. They can generally become hyponatremic, which is when there's a low sodium concentration in the blood. These women can also become hypochloremic, which is why when the chloride level in the blood is also quite low. A symptom that tends to elevate the vomiting with hyperemesis is excessive salivation. So a lot of people can get excessive saliva production in pregnancy. A lot of times, if you're somebody that is going through vomiting loads already and you're already going towards that route of developing hyperemesis, it can make the symptoms a little bit more severe. There's no practical way to prevent hyperemesis. You can manage it, you can try and find ways around it, just so the weeks pass through and you feel better. If it does get to the stage of hyperemesis where it becomes extremely severe, we do advise that you go to the hospital. However, there is absolutely no way to prevent getting vomiting and nausea, getting moderate vomiting, getting hypertension. These are just things that develop with pregnancy. These are things that your body have full control over and you can't do anything about. For severe cases of hyperemesis, you should definitely go into a hospital. You may be admitted, definitely, especially if there's huge signs of dehydration, huge signs of weight loss. You will be admitted to restore your fluid balance. If you're extremely dehydrated, most likely all you need is intravenous fluids, and that can only be done if you're admitted to hospital. They will also restore your electrolyte balance. So yes, definitely, if you are getting to a case where you're losing so much weight and you're keeping absolutely nothing down, definitely do present to a hospital. So for care and management, just a good way to look after yourself is vitamin B6 supplements. They can be quite useful. Now, we do advise that you're careful when taking vitamin B6 supplements, as overdose can be dangerous. However, you might find it more useful to actually just contain foods that have vitamin B6 in them, such as bananas, avocados, raisins, sunflower seeds, hazelnuts. Probably missing a few things there, but avocado and bananas are everyday foods that a lot of us tend to eat anyway. Sunflower seeds, we can find easily. Raisins, those are things that contain vitamin B6 and they can be quite helpful in the care while you're vomiting. Now, when it comes to hyperemesis, management can be a little bit different. A lot of times with hyperemesis, you do need to go to a hospital. When you arrive at the hospital, the midwives will do a weight check. Bear in mind that a lot of people that get vomiting and hyperemesis, a lot of times it starts at an early stage. So if it's going to start at between 5 weeks and so on, you may not have had your booking visit. They may have never weighed you before. So they will do a weight just to get a general weight on you on admission. The midwife will also kind of just observe your general state of hydration. Do you look pale? Have you been able to take in much fluids? They will ask you a few questions about kind of whether you have any past history of eating disorders. What have you been able to hold down in the last few days? How long has this been going on for? Just your general assessments. They will ask for a urine to test for ketones, especially bile, protein, glucose. The level of ketones in the urine will kind of tell the midwives what state of hydration you are, and then they can make their decision on whether you need fluids or what step to take that's best for you. The urine sample you give them will be sent to the lab. They do have to rule pyelonephritis as well, which is the inflammation of the kidneys. Your in and out balance will be monitored the whole time. If you're at a state where you're most definitely in need of fluids, especially, they will monitor what goes in and what comes out. And a lot of times nothing will be given by the mouth, especially if you haven't been able to hold anything in. They'll tend to give you everything IV until the vomiting settles a little bit. Well, some studies have actually shown that women with nausea and vomiting in their first trimester actually have a lower chance of miscarrying as the pregnancy goes on than women that haven't gone through nausea and vomiting. So nausea and vomiting has always been associated more with the female fetus. Eat small meals that are rich in protein. Studies have shown that the smaller portions you eat, the more you kind of survive through the day. So if you're eating big meals, a lot of times you get a weird taste in your mouth afterwards and the nausea starts to come back. Whereas if you eat little portions and just snack through the day, you tend to feel a bit better for longer. Don't lie down right after eating. Try to avoid eating and then going for a lie down straight away. Fill your house with snacks like fruit, yogurts, crackers, jellies, just little things that you can snack on through the day. That will just help keep the nausea suppressed. Try to avoid oily foods. Try to keep hydrated, drink loads and loads of water. If you're the kind of person that water doesn't sit well with you, if you're not able to keep the water down, freeze it, get loads of ice cubes. As you go on your day, just keep sucking on ice cubes. Try to avoid juices and really sweet kind of drinks, fizzy drinks and stuff like that. Because a lot of times, generally what happens is the aftertaste of the sugar just kind of sits in your throat, and that will just bring the nausea back up. So try to stick with the waters, keep hydrated, and stay away from the sugary drinks. It's important to wear comfortable clothing, do loads and loads of exercise. Guys, I know exercise isn't something a lot of people want to hear about at this stage, but generally if you can convince yourself to get up, and whether it's go for a run, whether you're somebody that used to go to the gym before, for your first trimester, keep going to the gym, keep to your regular routine. It'll keep you energized, and a lot of times you feel better. You feel a lot better. It's hard when you get out of bed and that feeling kind of wears you down, that feeling of tiredness wears you down. But if you can push through and get some form of exercise in, you generally do feel better. And has worked for me is, so what I do in the morning is have a little snack straight away when you wake up. I go straight to the kitchen, I get 2 or 3 pieces of crackers and drink some lemon water. Lemon water, I don't know what it is with lemon water, so I get some hot water, squeeze a bit of lemon into it, and just once that starts to cool down, just have that, drink it as I get the kids ready for school, and I'll have the cracker. And then I do a bit of exercise as much as I can fit in. Like obviously I am still working, so I'm off certain days. On the days that I'm off, I try to make sure I get a bit of exercise in. Do that, and then that a lot of times keeps me energized for the day. Guys, so we've come to the end of this video. Thank you for watching. If you have any suggestions for hyperemesis or vomiting in pregnancy that you've gone through yourself from the past, or anything that your family members have gone through, please comment in the comment section below so that other people can learn from that, other people can take advice from that. If you have any questions for me, you know where to comment down below. Don't forget to like, share, subscribe. Let's grow this family, guys. Thanks for watching, guys. Stay tuned for our next topic. Thank you for tuning in. I'm going to be leaving a list of links down below in the description box. Just links that might be helpful when it comes to hyperemesis. Please take a look. Thank you.